In NHS healthcare, the quest for better patient care is never-ending. Artificial intelligence has a transformative influence on healthcare. AI helps him analyze patient data faster and more accurately. This leads to precise diagnoses and personalized treatment plans. AI also helps in predicting potential health risks. This proactive approach improves patient outcomes significantly. AI is not replacing doctors, but empowering them. Together, they are revolutionizing healthcare. Empowering the NHS with AI hallmarks a revolution in medical care for a healthier future. Because with AI, better patient care is possible.
Thank you everyone for joining the 4th webinar episode today that is part of a series on the transforming role of artificial intelligence for healthcare in the NHS, organized by Conservative Friends of NHS. My name is Zarmina Jafar and I'm currently serving as Head of Strategy at THP and participating as Healthcare Technology host for today's webinar. Today's session is on the topic of AI-empowered medical documentation, as in terms of funds, time, and trust. And today we discuss how AI-empowered systems offer potential solutions. We extend our gratitude to Conservative Friends of NHS for making this webinar possible, along with our guest speakers who are with us today. To start with, I would like to invite Dr. Ashraf Chohan, Fellow of the Royal College of Surgeons in the UK, an experienced orthopedic surgeon and founder and chairman of Conservative Friends of NHS. Welcome, Dr. Chohan.
Thank you, Zarmina. I welcome everybody in this 4th webinar. Just a little introduction about Conservative Friend of NHS. We are affiliated group of Conservative Party, but we are all most of us are medical professionals, and many of us has achieved a maximum in our profession. So we are very proud of all our members. In this, although we take part in all other activities which is helpful for the party, which includes day-to-day campaigning, fundraising, all political things, but at the same time, what we do differently than all other affiliated groups is that we work on our medical profession. We had a series of webinars in the last couple of years about how we can improve NHS. We have given suggestions to the government. Some has been taken up by the government, some has not been. As now everybody is talking about artificial intelligence, we are very lucky to have Dr. Chughtai as one of our members. He has worked in this sector over the last decade. And probably he would be one of the first few people who have worked in AI relating to medical profession. He has been going around in the world and he has been talking about it. We are very lucky that he is one of our members, our friend, and he is hosting this series. He did a first couple of webinars, which particularly the one about virtual nurse. Today's one is about AI-empowered documentation, and I welcome everybody. I thank Zarmina, and I hand over back to Zarmina to take the proceeding further. Thank you.
Thank you so much, Dr. Chohan. I would now like to welcome Dr. Suhail Chughtai to present the keynote talk. Dr. Suhail is an orthopedic surgeon based in London with over 20 years of experience and is an AI and telehealth strategist. He is also the Digital Health Director for Conservative Friends of NHS and CTO of the Health Bank in the UAE. Welcome, Dr. Suhail.
Thank you, Zarmina. I appreciate your contribution to this series. And I really think that this is a very important topic we are discussing. It has so much value, so much information we are sharing with our colleagues who are handling patients day to day, whether nurse, whether doctor, whether any healthcare worker for that matter. So are you able to see my screen, Zarmina? And
yes, thank you.
Wonderful. So may I start with the permission of Chairman Dr. Ashraf Chohan, who has been very focused on getting this particular topic discussed. And when we met a couple of months ago on this topic, he in fact hosted a party for the health minister then, MP Steve Barclay. And then he kind of coined the idea that why don't we discuss artificial intelligence? I welcome that, and that is why we are conducting this. So thank you, Dr. Ashraf, for instigating this whole series. So far, what we've done is, on the 1st of November, we started transformative innovation of NHS via artificial intelligence. We discussed the overview, the challenges and opportunities, and I gave a small presentation covering that. On the 8th of November, we opened the topic to take it deeper to the role of artificial intelligence for NHS. And many things were discussed and basically introduced at how AI can help. Particularly the access to care, as we went on to 15th of November, as Dr. Chohan mentioned about the virtual Jafar. I created a persona named that virtual Jafar to act as an artificial intelligence nurse. This is something which I would be discussing and referencing back in the future webinars, but I gave a demo, which I appreciate people who showed a lot of interest in that. Today, we are talking about artificial intelligence powered medical documentation for NHS. And that topic is such an important topic where I don't think we have really any escape. We have no excuse not discussing it. So may I just introduce you what we're talking about, first of all. You know, medical documentation is a privilege to have so much documentation, but at the same time, it's a burden. And if it's not handled properly, we are facing an enormous challenge. Take one example of clinical negligence litigation. The 4% of the trust income loss is because of clinical negligence. Now, the clinical negligence, the defense of NHS is very poor. And one reason is poor documentation. Even if the doctor and nurse have not committed any negligence, they are unable to prove it because the documentation is lacking. And that is very important, that we haven't done anything wrong, but we are still being blamed for. That is an important area, and we must emphasize that how critical is that to ensure that we have proper documentation. So we started with handwritten notes, and me and Dr. Chohan and Dr. VP Singh will know that how it started was like this. Clinical negligence at the time when there was, people could not make out what the notes are, ineligible notes. Again, the doctor was blamed, and no way we could search through that. So that was the drawback. But then it was taking also longer to write. Then came the audio typed notes. And I have seen the both areas, and Dr. Chohan probably before me has seen that how secretaries shifted from handwritten notes to audio typed notes. And that was the time which NHS saw a significant transition. Now, remember, please, we speak 7 times faster than we write. We speak 7 times faster than we write. So imagine we moved 7 times faster in medical documentation at that time. Then we came the pre-formed templates, like you can pick up a template, like knee pain template. But that was, again, counterproductive because there was a lot of adjustment and editing required. Not everybody was tech savvy to do that. That is the real change. A lot of medical transcription companies opened up. You just dictate the note and send the file. I have it locally transcribed into a text typing. And then came this. Artificial intelligence voice to notes creation. And this is important because the generative AI, the chat GPT type AI has just come in the market. And remember, AI voice notes. I'm not saying AI voice to transcription. I'm saying AI voice to notes creation. And that is an important concept, that we don't create just the text. We create the proper structured medical records. And that is the biggest revolution or maybe evolving step for NHS in medical documentation so far, at least in my career with NHS. So medical documentation, what is the challenge? I'm trying to get Saima in. Dr. Saima, you're in now? I think she was losing the connection. So time-consuming data entry, reducing time for patient care. You know all that. The doctors know that you spend 43% as much as that time in clinics to manage the documentation. 57% for the patient care. It's a dilemma. It's a dilemma that a doctor is working as a stenotypist. in some regards, typing the notes, and losing concentration on the patient's facial gestures. Patients don't like it because you're looking at the screen while they're talking to you. That's not the really ideal way of doing a medical consultation. And then the error rates in manual data entry, which cause inaccuracy. Inefficient medical records management causing delays, like the text was not put in the right time or the right place. And then, of course, the inconsistency, like spelling errors, like incomplete medical records, like delayed medical record entry. All of this put a lot of burden on NHS. And let's not forget that if you want to transfer from one system to another, the IT systems will not allow that easily. So all these 6 challenges, and there are probably more as well. I just want to enlist only 6 challenges here. And I take opportunity to welcome Mr. Bill Morgan, who will be formally introduced by Dr. Saima. Maybe I should take a pause here in respect of Mr. Morgan's influence and help he's providing to NHS. And at this point, Saima, I will take a pause and I give it back to you so that we can welcome formally Mr. Bill Morgan. Saima, over to you.
Thank you. Thank you so much, Dr. Suhail. And first, I would like to express my gratitude on behalf of Conservative Friends of the NHS for Bill Morgan, advisor to PM, for joining us, taking time out from his busy schedule, and despite of IT and everything, managed to join. Thank you so much. To introduce Bill Morgan is joined Rishi Sunak's policy unit as his health advisor in November 2020. Beforehand, he worked as a visiting fellow at the King's Fund and an advisor to the think tank Engage Britain. Between May and October 2022, he did that, and he previously co-founded and co-led one of the country's largest health communications consultancies, Incisive Health. Earlier in his career, he worked as the Conservative Party's health advisor in the mid-2000s and a special advisor at the Department of Health in the early 2010s. Welcome, Bill, to the CFoNHS webinar.
Thanks so much for inviting me along today, and sorry about the IT issues. I'm dialing in on my iPhone at the moment whilst my computer gets sorted out. So hopefully that'll be sorted out soon, but really looking forward to hearing from you all today.
Dr. Suhail. Dr. Suhail Chughtai, you can have your presentation.
Thank you, Saima. Thank you, Mr. Morgan. I just resumed from where I left over, and I'm just going to share my screen. Just allow me a second, please.
And okay, so we are talking about, if you'll kindly briefly give an overview so that Bill knows what we're talking about today.
Hi, Bill. This is Dr. Chohan. Just a brief note before Dr. Chughtai continues. This is a series of webinars we are doing about artificial intelligence. Today is about artificial intelligence empowered documentation. Last week we did about virtual nurse. So we have just started it. So welcome, and over to Dr. Chughtai to continue from there.
Thank you, Dr. Chohan. So it's my privilege to present this important topic. This is the 4th webinar, and today we are discussing how artificial intelligence can really help NHS to streamline operations, and one of them is medical documentation. And before the slides I went through, I showed that how the burden of medical documentation is intense, and how artificial intelligence is going to change it. Let's talk about it. So first of all, we know that medical documentation is time-consuming data entry. 43% of your time in the clinics is actually entering the data into the computer. That is not right. The doctors are not supposed to give 57% only of their time to the patients. And the patients are looking at the doctor, and the doctor is looking at the computer screen. So one of my missions, I've been working in IT for about 30 years alongside my orthopedic practice. And one of my missions has been to make computers easy for the doctors. This time it is to remove the keyboard and the mouse for the doctors, let the doctors talk to the computer, and let the notes be created automatically through artificial intelligence, through the systems. And I want to show you how to do that. So the other challenge we are facing is that manual data entry is causing inaccuracy. Because humans, they get tired. They can not be attentive all the times. And then sometimes the medical records management is not up to mark. Either we are behind the time, or we are putting the wrong data in the wrong place. And this is causing inconsistency in documentation, and the standards go down. The overwhelming documentation burden on NHS staff, I don't want to go into figures, but you can see the staff burnout rate. And I'm going to show you one slide that how this is affecting the doctors to go to a very high rate of suicide, not only in America, in Britain as well. And then the systems don't talk to each other because everybody has their own plugins, own webinar, own kind of systems. They don't talk to each other. And that is the problem with IT systems without artificial intelligence as a wrapper. So the medical errors lead to high litigation because the documentation is too much a burden on the doctors. So you just take a look at this, 2.2 billion on litigation costs in 2021 to the NHS. Even 50% of that could have been reduced if there was an efficient system, and that 1 billion could have been spent on the patient care. And then it is 2.4 the year before. NHS is now expecting this to go to 11 billion. So they're keeping 11 billion aside for litigation expenses. Isn't that sad that we are keeping 11 billion for non-clinical care just to protect ourselves? That is actually an area where we can definitely improve. So we don't have defense. When the medical records or medical documentation is incomplete, inadequate, inconsistent, how can we defend ourselves? We may not have done the clinical negligence. We may have been very, very, very good in clinical care, but we can't prove it because the medical documentation, due to the burden, is not adequate. Inaccuracy, performance audits, they are wrong figures. We are showing either too good or too bad because the data is not accurate. And that creates mistrust in patients when you can't find the medical records. You can't relate that this patient was allergic to penicillin. It's mentioned in the record, but you can't find it. This will create mistrust on NHS by the patients. And then, of course, where we are billing, we are using ICD codes. The inadequate coding can lead to improper costing. So I want to mention that. I do want to mention that the 50% of doctors in the UK are experiencing symptoms of burnout, young and senior both. And that is a significant area. We must not ignore that. So the burden of the burnout is mainly on the primary care, family medicine, obstetrics, internal medicine, pediatrics as well. And remember that this is a startling figure. How can we accept that? Male doctors, 2.92% at a higher rate of committing suicide than general population. They are intellectuals. They are supposed to know how to protect their negative mental attitude. But the burden, Mr. Morgan, is so much. That burden has to have a solution. And even more in female doctors. They have other family pressures like kids and household management sometimes. So that is also a startling figure. 3.29% more susceptibility to the general population. It's very sad. So there we stand. Artificial intelligence. I again say that I said this in the last 3 webinars. Please do not assume artificial intelligence is going to replace us. Nobody can be more intelligent than humans. We created artificial intelligence. How can they replace us? It's going to be always in the assistive role. We control it. So we can keep it under as an assistant. And I gave a demo of that as a virtual nurse, virtual Jennifer last week. So please do not be apprehensive that AI is your replacement. It's not. I'm going to give you an example. This is a teleconsultation I was doing. It's not a real patient, it's a mock patient. Now, this teleconsultation, after that was the time, 6 years ago, 5 or 6 years ago. I create software of telemedicine. This is one of the softwares I created. After that, I created notes. It took me about 7 or 8 minutes after each consultation to create notes, and then I see the next patient. In this case, if artificial intelligence was available to me that much, the notes could have been created by themselves. Just take a look. This print will leave your fingers free, and you can still use the mouse and the keyboard. And your fingers are free in this, as you can see.
Yes.
If I can just explain a little bit more, the nerve which goes under this band is so this could have been easily transcribed, and it would have landed into the notes. And you see that I programmed this conversation. I did that today, actually. I transcribed this to a system where I could have two different voices in two different colors. So I can say that, like, whenever the voice change the color, change the font. And then I can start putting that, I can drive this note into whatever the field I want to drive it to, like diagnosis, like treatment, like prescription. So once I finish the consultation, my NHS template will be ready for this patient. That means I don't have to go and do it manually. It is such a relief that 43% of this time can be cut down to maybe 20%, and we can see more patients. We can have more patients in the clinic and less waiting time for the patients. So I just want to briefly introduce that what are two types of artificial intelligence we can benefit from. The traditional AI, where we use Python language. We used to pick patterns that what's the cancer cell like, and we used to have a structured data like medical records going into the system, and we can pluck the information out of that. So we had predictable outcome, and it depended on human supervision. But ChatGPT-like AI, the generative AI, the large language model, the natural language processing, that works like a neural network, that generates patterns. So it can give you a provisional diagnosis. It can suggest you. It does not require a structured data. You just provide the data, medical records, and ask the computer or the natural language processing to find out the inference. It is very contextual and creative, and there's less dependency on human supervision. So how can we benefit? How can NHS benefit from artificial intelligence? We can create very fast medical records, auto summaries of long audios, automate documentation. All of this means less time of the doctor in the clinic on the computer, and have an eye contact, have an empathetic communication with the patient. The doctors are so stressed in the clinics, especially the young doctors or the not computer savvy doctors sometimes. How will I do this? May I go wrong? I'll be blamed for wrong notes. So they lose the concentration. They don't focus. They cannot focus on the patient so much as they would have been. And that is a dilemma. So medical records management, not just creation, but the management. For example, efficient and error-free filing. I just gave you an example that diagnosis will go into the diagnosis field, prescription will go into the prescription field, and so forth. Fast and accurate retrieval. I can say, give me the prescription I gave last time. That's all I have to say to the computer. Or, what was the diagnosis? What was my care plan last time? The screen will immediately show that care plan. Auto extraction and insertion. Medical images-based filing. I can say, can you show me the last X-ray of this patient with a disc degenerative disease with root impaction? Can you show me the pathology slide or the radiology report of this patient with marking of disc degenerative disease? Sorry, I'm orthopedic surgeon, so I'm thinking of that. Or ACL rupture. So it'll pick up the right report for you. You don't have to look at and search for it. Just speak to the computer, remove the keyboard, remove the mouse. And that is perhaps one of my missions as well, to get keyboard and mouse out of the doctor's way. And of course, auto summarization. Now, long conversations. It will actually remove the doctor's jokes he or she makes with the patient. It can remove the hum sounds, the door opening sound. Up to that level, we can summarize. That remove all the crap, get the right notes, summarize it, and at the end of that, send this summary to the GP. That is such a blessing for the doctors. Most of us sitting here in this conversation would love this idea, and I hope that this is going to be a reality very soon. So, auto summary. imagine that at the end of the notes, you can even review that what is the care plan I talked to this patient about. Even you can go through the summary with the patient towards the end of the consultation. The patient will develop a trust in you that the doctor took me on board. So the third part is medical record cross-referencing. The cross-referencing means that I am an orthopedic surgeon, but what about the internist, the physician? What about the guy, the general surgeon, because this patient has a gallbladder problem? I want to cross-reference my notes with his or her notes, other specialty notes. Is there a contraindication or a relative contraindication to what I am planning? I'm giving this patient naproxen. There could be a history of peptic ulcer. That cross-referencing is a blessing. That will pull out what a doctor should not do, what is supposed not to happen. Because we don't have time in the clinics, we search for that, we don't find it, we assume this patient has no contraindication. So the NLP will detect the linked items. For example, allergies. The natural language processing will provide you a wider holistic view of the patient healthcare profile. It will tell you patient walks for 1 mile a day, he's working in a stressful environment in the daytime, he's got a past history of all that. That thing will come up the moment you talk to a computer. The natural language processing of artificial intelligence will understand what you want from this patient's medical records. Searching probably will not be able to get that. And same way, it will provide you cross-references between medical conditions for a better management. That is the real advantage, and I wish that we implement it sooner than later. We can save hassles to so many patients who will benefit from it. The doctor is not the only beneficiary. The patients are. The whole admin system is. The last part I want to quickly touch before I close my presentation is enhanced data analysis. You know, machine learning uncovers data insights like what did we miss? What was wrong in our management before? So if you can pick up all the cancers which were diagnosed late, we can go back to the records and say, can we diagnose them early? We can pick up the markers. Image analysis, you know, we know that we can have a virtual pathologist, a virtual radiologist to pick up the suspicious looking slides. They will not replace the specialist because we cannot blame the computer for something going wrong. We need to have a human to take responsibility. And of course, the analytical dashboards. And this AI model can improve results of the care. So that is where I stop. I wish I could share more, but the time is limited, and I want to give it back to Zarmina. Thank you.
Thank you so much, Dr. Suhail. That was insightful and with a lot of information. I would like to welcome Dr. Saima Niaz. Dr. Saima is a consultant psychiatrist and deputy chair of Conservative Friends of NHS with a special interest in raising mental health awareness. Dr. Saima will be introducing and leading the panel session today. Welcome, Dr. Saima.
Thank you, Zarmina. I'm going to introduce panelists, and I'll request them to keep their views, comments very brief because we have very limited time. So first, I'm going to introduce Dr. Tabinda Dougal, who's a consultant endocrinologist, and she works in Royal Cornwall Hospital, and she has been a lead in empowering patients, medical students, training, and developing pathways in all ways of the patient care. Can I request Dr. Tabinda to say a few words or brief comment about AI and your experience, and then I'll move to the next panelist.
Thank you, Saima. Yes, I will remark on this as an endocrinologist, and I think that recently what we have seen, what has come through NICE is the development of closed loop system for people with type 1 diabetes, and I think Britain would be the first country to introduce this on the free to the state on the NHS. A system which would sense the blood sugar, and the pump would pump required amount of insulin according to the blood glucose at that time. So this would really revolutionize. This has worked on algorithms, artificial intelligence. This would really revolutionize the care of type 1 diabetes patients, which I probably won't be there to see the results of it like 30, 40 years down the line, the reduction in complications, but it would really change my specialty forever. There are my colleagues who would think that we would be out of our jobs because of this, but this is really a great thing for our patients, and we really welcome such developments. And I think the more AI develops, the more such things would come too.
Thank you. Thanks. That's very useful to know. And next, I'm going to introduce Dr. Irfan Rashid. He is a GP in Bedford, and he's also continue to get further training in pediatrics in UK. He's currently doing from UCL a master's degree. So he's also I think I heard my echo. And he's a partner in one of the largest practice in Bradford, and provide healthcare services to the population of 25,000. So Dr. Irfan Rashid, if you'll give a brief comment you want to say about your experience with AI.
Yeah, thank you, Saima. When I was a junior doctor, came to UK 20 years ago, I had a dream. I wish I don't have to write a single word in patient's notes because it was so irritating. Okay, and it was so time consuming. And when you are in a rush, it's taking so much time. So I think my dream is coming true that hopefully, especially you can imagine in primary care, we got 15 patients, 10 minutes each. We have to see them. And if they are more than one problem, being a partner, you cannot refuse, go and come back next time. We have sometimes we deal with a problem, maybe 1, 2, 3. I personally never say any of my patients go and come back because I can't discuss your second problem. The reason only because I don't have time to document a second problem. Okay, it will take me 5, 6, 7, 8 minutes to document it. I'm running late. So I'm very excited that this system of, I'm hoping this will be improved ethically and we will get training as a doctors. I think the main thing we are lacking at the moment, the juniors, the senior doctors, they are not trained in artificial intelligence. They don't know, most of them, how it works. Okay, so this is one thing I'm excited that we will save a lot of time. Okay, primary care, I don't know about the secondary care. They got their time restraints as well. But as a GP in a busy practice, our aim is to save time and give the best care to patient. That's only possible if we avoid documentation, risk assessment, the patients, the risk assessment AI has done. Because we are humans, we are bound to do errors. Okay, you will one another day end up doing errors. And these things, if they are limited by artificial intelligence, one is saving time, documentation, okay, cross references, allergies, which is already in place most of the time. System give you flag, patient is allergic to blah blah blah, and the most of the time you might notice the patients complain that GP wasn't looking at me, so I don't know whether he's heard because he was too busy in typing. Okay, so he was just trying to get rid of me. He was typing it. I think if you look at the patient, listen to them for 5 minutes, I think half of their problem is gone. For us, this is only the one part. The other thing which I would like to comment, obviously, the coding system Dr. Chughtai mentioned, most of the time GPs do a lot of work and it's not claimed because it has to be claimed manually. You have to generate reports, you have to do audits, submit to NHS England, and they pay you according to efficiency. And most of us, they work hard to provide the best supportive care, but they cannot prove it by evidence. They cannot prove it by coding, or maybe they're doing it like they're doing the vaccination of children's for this and this and time, and they're not claiming it because they don't have any effective source of claiming it to avoid errors. I think if we get some kind of, if they will get this kind of reassurance that whatever hard work they have done, it will be paid to them, that would be probably financially important for primary care as well. I think there are lots of other examples I can give, but I know we are short of time. So if there is anything somebody want to ask, I'm happy to answer.
Blessing to have AI and data collection through AI. So I'm going to introduce our third panelist because time is short, so I'll request Dr. Rajinder Paul Singh to keep it very brief because we want to use the time for panelist discussion. So Dr. Singh is one of our dedicated member of CFoNHS. He's a consultant transplant surgeon in Manchester, and he's joining from his holidays because he's very keen to be a part of this AI project. And he's trained in abdominal organ transplantation and immunosuppressive strategies in the United States. And he's a clinical researcher with several peer-reviewed scientific publications. He's the infection prevention and control lead and a lead in the evidence-based practice. So Dr. Rajinder Paul Singh, over to you for a very brief comment, and then I will start our discussion. Thank you.
Thank you, team. Thank you, Dr. Chohan. Thank you, Suhail, Tabinda, everyone. It was really very nice for all of you to come together and bring up this very important topic. One of the most valuable thing that we will benefit from is appropriate robust documentation, because robust documentation will lead to evidence-based medicine in the term that a lot of audit and research can be conducted easily and authentically. It is not very easy for us to get and collect all the data from paper documents. But with the electronic system introduction and artificial intelligence coming in, the patient pathway processes, the life of the clinician, life of the patients has become very seamless, and it's very good. So congratulations, and I think that that's the way forward. Uh, we should identify some of the important patient areas where patients are struggling, so that when we feed it into the system, then that output would translate into a good patient experience. We have discussed several of the things, and just to reassure Tabinda that in her lifetime, she is already seeing the benefit of insulin delivery system. For instance, as a pancreas transplant surgeon, we see a decline in the number of solitary pancreas transplant now, because the insulin monitoring and sensors are doing an excellent job. So congratulations. Uh, One of the important things that I would like to suggest to Sohail would be to work on one area which would be very important. Very often when we go into the hospital, you will see that there are patients with a piece of paper looking at it, and they are looking hither and thither, trying to find out where they are supposed to go. In a very big hospital, they get lost. They will have a piece of paper telling them to come over there, but then there are 20 areas, 20 departments, and they struggle. And a lot of the time, the patients are led by the dedicated doctors or nurses who look at the face of the patient and they understand that they need help. If artificial intelligence can come in here and make this experience for the patient great and good, I think that would be a feather in the cap for us as CFoNHS to lead on it, and for Dr. Chughtai and Dr. Chohan. And the other thing, as I mentioned, is medical legal. Uh, it is going to be very easy for doctors, for lawyers to accurately get the data out from artificial intelligence fed systems like we have in Manchester. It's called Hive. And Hive, after it has come in, it has been made life very easy for us. There is absolute transparency in the system. We are able to look into each and every aspect of the patient care by the minute, who saw, what they did, etc. So it brings in a robustness of transparency, and the data collection would also be very useful for the lawyers. Remove unnecessary claims where you can easily prove that whether or not we have done a good job, etc., or if there are any experience to learn from. So yes, so it's a win-win situation. But as I have spoken in my last discussion, we are the people who are mastering the artificial intelligence. In fact, it's not artificial intelligence; it is human intelligence fed into a system to serve ourselves. And if we are able to feed into it in a very good manner, then the results would be equally great and fruitful for us. So thank you. In the interest of brevity of time, I rest my case here. Thank you.
Dr. Raj. So I'm handing over to Dr. Suhail Chughtai for panel discussion. Thank you.
Thank you very much, Dr. Saima. Mr. Morgan, you have been very supportive in your capacity as a healthcare advisor to the PM. Where do you see artificial intelligence helping us? And is there a priority or any preference given to a technology influence in this domain for NHS? Please enlighten us.
Yeah, thanks. And thanks again for inviting me to join you today. So I think there are sort of, I mean, like, first up, we see AI as an enormous opportunity, both to deliver greater productivity in the NHS, but also to deliver better patient outcomes. So there's sort of two opportunities we need to grasp, really, and it's a big agenda supported by the PM personally. You'll have seen his AI summit, and in general, he wants to position the UK as a sort of global hub of AI development, AI regulation, AI learning, really. So the PM is very, very keen on this agenda. The health services too. So from the NHS England side, they see these opportunities front and centre. I think there are sort of two categories of AI tech, or at least two broad categories we think about. The first is AI tech used therapeutically. So, to support diagnosis, to support radiologists, to support therapeutic decision taking. So there's that sort of category of tech where it's almost putting rocket boosters on tech which can be used therapeutically. I guess the second category is I think what you were talking about when I joined, which is AI augmented administrative tasks. So ambient documentation was what you were taking us through there, and in both categories we want to take really big steps to embrace AI in the coming months, years. So on the first category, AI medtech, if you like, we're eager to explore the creation of a sort of medtech pathway where NICE is empowered, like it is for drugs, to consider the cost effectiveness, the value for money of AI therapeutics, and then the NHS is mandated to make use of it if there's NICE approval. So that's for sort of AI-powered medtech used therapeutically. The second category, and in particular ambient documentation, and we really, really know the potential upside of ambient documentation in terms of the potential clinical time it will save. We're considering how best to roll that out in the NHS over the coming years through a Treasury-led productivity review, which is going on at the moment, and it was led by our Chief Secretary, John Blair, and he's just been replaced by Laura Trott in the reshuffle, but they're overseeing this productivity review. And one of the questions they're looking at is, how can we best embrace ambient documentation? How can we support its adoption in the NHS? I guess we've got questions for yourselves, because what we hear from the NHS is that there are only a few companies who've absolutely nailed the development of this solution. Microsoft is one of them, I'm told, through its subsidiary Nuance. But the NHS sees the market developing in this quite significantly over the next year or two. And what they don't want to do is, back a single supplier now. If in 2 years' time there's a competitive market, there's many better suppliers out there. So I'd be interested in your take on this question of ambient documentation, how you see the market developing over the next couple of years, and whether whether the NHS is right, frankly, in their take that this market's going to develop significantly, and therefore we should pilot the technologies which are in place at the moment, but wait and see whether we can get better value for money, better outcomes for patients if we just wait for a bit of time, 18 months, 2 years maybe, and then procure from a very competitive market. So I'll be interested in your views on that.
Thank you, Mr. Morgan. I want to go to Dr. Ashraf Chohan, but before I can just address your question, and I want to patch my answer with one of the questions the audience has asked us. Atif Mahmood also asked that, can the current AI technology be patched into NHS system, or will it need a completely new upgrade? May I just, with your permission, Mr. Morgan, address this point first, that whenever you do a new thing, there got to be a cost of mistake, a cost of trial. So there's a cost of trial in terms of time loss, in terms of training new people, in terms of upgrading some of the RAM computers, the old monitors. But the good news is AI is not computer intensive. AI is web intensive. Please try and differentiate the two. AI is web intensive. So you need a wider tube to pass the data, internet speed. But computer processing is, all you can do is i3 with 4 GB RAM. That is enough. That's a very good news for NHS, because they can do less investment and more output as compared to changing the whole paraphernalia. And Mr. Morgan, your question. We basically feel that, I think Tabinda also said that, whether I'd be alive or not, trust me, every morning I wake, I've been doing computing for 30 years, healthcare computing. I've written plenty of software, many books, many softwares and all that. I feel I wake up with new systems when it comes to generative AI. The progress is not in weeks, it's in days. Sam Altman was fired 3 hours before he was reappointed by Microsoft. We are talking about hours, not even days. So Tavinda, it's a good news for you. You probably see it next week, what you're dreaming for seeing in years. That is where we stand. So Mr. Morgan, this is what we need. We need the current generation of doctors in 50s to be motivated that it is for you. They think that it's not for us, it's for the junior doctors. That mindset needs to be changed by people, old people like us, motivating them. And I will come to Mr. Singh in a moment. We need to motivate. We need to take lead. Doctors in 50s need to be taking lead in AI, in technology, so that they become motivating examples to youngsters. It should not be other way around. It should be this way around. Mr. Singh, you have a question.
I would like to address one issue that Mr. Morgan Bill has raised. It's about the cost factor and whether we are doing it right and how smartly. Now, this is very, very interesting, because in Manchester, we purchased the Hive system, which has it is costing a staggering 180 or 200 million pounds. Now, one of the things is that a lot of the diagnostics and other patient pathway systems were splintered into several groups, and one of the justification is that all of them is now coming under one head, and hence over a period of time it will translate into cost saving measures. But the most important thing we have to realize is this 180 million pound is going out of the country into United States, and whether the splintered amount of money that we were previously spending, whether that was fed into our internal resources, was paying the salaries of our own people, and if we can do something which is more indigenous rather than to follow a process where the money goes out of the country. So I am a very big fan, and I do support artificial intelligence, but I certainly would caution the government that we need to be very, very careful about where we spend, and if we are a bit smart, that the spending is something that is limited to our own nation, and we feed into our own system rather than let the money be siphoned off into another nation. And that is where people like Suhail Chughtai would be very, very useful, because this young doctor, he is brilliant, and the amount of energy that he's putting it into the system, under the leadership of Dr. Chohan, I think this is the way to go. And it would be useful if we develop our indigenous system and we feed into other countries and not let money be siphoned off to United States and other nations. Thank you.
Mr. Morgan, you'd like to address that before I go to Dr. Chohan?
Yeah, I mean, it's very good. It's a very good point. I'm conscious that the US always manages to steal a march on tech development, but of course, one of the I mean, this is why the PM is so keen for the UK to become a global hub for AI and a centre of AI regulation as well as development. Because if you control the regulation, a lot of the time the development happens here as well. So this is part of a sort of grand plan, really, to make us the global centre for AI development. It's a very good point that you raise, and it does make me think that maybe there's something in the NHS's approach that we need to take time to make sure our procurement strategy is right, to make sure that if we're going to spend a lot of money on ambient documentation or other AI related tech, that it comes with investment into the UK, so that our scientists get the benefit and we get all the sort of spillover economic benefits as well. So it's a very good point, which I'm sure we will reflect on with Treasury and NHS and all the others who have an interest in this.
Thank you, Mr. Morgan. I want to go to Dr. Chohan. But before I do that, I want to thank Mr. Singh for calling me young. It's being recorded, so it will stay on record as well. Dr. Chohan, what's instigated you to start this? It's been quite an exercise. Behind the scenes, a lot is going on. But what encouraged you to bring me in to help the systems you're thinking? What is your idea behind AI? Please enlighten us on this.
Yeah, I must thank everybody, Bill especially, and Dr. Chughtai and everyone. I just give an example why it is important. And Bill divided these two things separately, but actually empowered AI records as well as clinical practice, they end up in one situation. For example, quite some time ago, because when you receive the patient in emergency, you treat the patient and many times you don't have any attendant, you don't have any medical history. I was operating on a patient with fractured neck of femur. We needed to do total hip overnight. And on the normal tests and everything we did before, like we normally do, there was nothing to pick up any abnormality or anything. And when I was doing the hip, the bleeding started, which would never stop. I transfused the lady, I think 10, 12 units, and the blood didn't stop. And then obviously we did what we could and done, and then we got contacted a GP. The following day we got the record, and the patient had Paget's disease. And this is one of the million examples where, without having access to the medical records, without having proper information, you end up in a situation where you risk the life of the patient. So this is very important that the medical records and all the treatment and everything is available on just a click of the computer. Why I started this, obviously, it is like AI is in vogue, and we are talking about AI in every sector. And life is most important than anything else. And obviously, NHS is a department which is looking after the health of people. And of course, as you said at the start of your briefing today, that most of the time we used to spend in writing, and then doctors' writing is only God can read. So, and that writing, if any other doctor has seen the patient, it's very difficult to read. So today's discussion about record, obviously there are many other areas where AI will be very effective, but in this particular subject, I think this is one thing which should be done first. And secondly, what Raj said, and obviously Bill is very interested. I don't think as expert we will recommend that that this task is suddenly given to Microsoft or anyone and we spend billions. It should be in the staged process, and there should be input from the clinicians that what is the most important thing to start, where and what records are more important. And we should start this use at a smaller level, and gradually we should increase according to the needs. And of course, we can use the indigenous expertise we have at different levels. So I believe that before government takes a big step to move into investment, there should be panel discussion, and we are very happy to contribute to start, and we should have a staged system to get into this. So basically, the importance cannot be overstated, and moving forward, it should be into the staged situation as Raj suggested. So, Bill, at the end, as Dr. Chughtai asked the question, our purpose is to discuss this, but our purpose as conservative friend of NHS is that we transfer our resources, abilities, intelligence towards the government, and we assist the government in this process like we do in policy making and other areas.
Thank you, Dr. Chohan. It is very insightful. Your enthusiasm is inspiring us, so please keep doing so. Can I just ask this question? How can we, Dr. Hafizullah, thank you for asking this question. How can we overcome the challenges in introducing AI into NHS? Dr. Chohan gave one answer to that. It could be staged. The second thing is pick a specialty which is more suitable to AI. I want to pick Dr. Saima Niaz in consultation in this here. She's a psychiatrist. Long consultations, half an hour stories. Can these not be summarized and tagged accordingly so that at the end of that, one-page summary of 30 minutes long consultation? Saima, please share your thoughts on that.
We are waiting for Bill to say more. Yeah, it's not 30 minutes, it's 60 minutes and sometimes 1.5 an hour. It's a life story of a person, so even 1.5 hour is not enough sometimes. We want some system through AI where these data collection is already there, and it's everyone can access that, and to build on that, it will reduce our time, it will reduce patients' stress while giving that history, long life story. They can take their time and give that, fill in the form through AI. And it will reduce loss of time, and there is shortage of doctors in psychiatry as well. So it will really help in with not only taking up some unnecessary tasks and giving more important tasks to the doctors. Thank you.
So you have trust and faith in AI being introduced in psychiatry, which is very encouraging to know. But Bill, I thought you wanted to say something. Please go ahead.
No, I was just going to say, I'm very grateful for your expertise and your input, as I know the Prime Minister would be as well. And as we continue on this journey, as we extend the use of AI into different settings in the NHS, please do carry on sort of contributing your thoughts to us. It's really helpful. And indeed, I was just discussing with someone today the potential of AI in mental health services, particularly given the growth in demand. We're expecting the demand for mental health services to grow much more significantly than the mental health workforce will be able to grow over the next 5-10 years. And the potential benefit of AI there to plug the gap, both in terms of reducing the administrative burden on doctors and other clinicians, but also actually to engage in patient care. I mean, we're right at the foothills of this journey where AI can be used to, for patients to engage with and to help them address, their mental health challenges. But the evidence is already emerging that, you can use AI bots to help engage with people encountering mental health challenges. And indeed that some categories of patients actually prefer to engage with a computer rather than a human even. So it's got real potential in the area of mental health, which we're well aware of. But as I say, we're right in the foothills of this journey. So we need to make sure the tech is safe and effective as we continue to roll it out in the NHS.
Safe and effective. I think these are the key words. Thank you, Bill, for reminding to us that doctors have to be safe before they're good. Tabinda, there's a question on the screen.
The question on the screen: how is AI transforming healthcare delivery other than administrative, and can artificial intelligence in hospital really revolutionize patient care, and where is it being piloted? I think like I did speak about my own specialty, like say we have got the sensors that are actually constantly alarming and working, and And I guess we've seen less and less admissions of type 1 patients with hypos because they have alarms at home. And I guess that is how it's working. Obviously, I think I was just laughing at when people were saying that the writing of doctors, but I said it gives the junior doctor something to moan about, isn't it, when they couldn't read the consultant's writing. So I don't know what they're going to moan about now. So I think writing is sometimes there are people who are hiding behind bad handwriting and they will come around and say, oh no, I didn't say this, I said this. So I think it will add in accuracy and it will make it more crisp. The patient care becomes more crisp because it's at the time that is used in writing, again, as you said, will be used in patient care. I do have some concerns about that, and I think there'll be another forum to discuss these, would be the algorithms that are made by humans to put in, to concise that conversation, who determines what is important. Because as you said, there are, the best speaker will speak about 2,500 words an hour, whereas the mind is thinking 3,000 words a minute. So I think there is a reaction that is invoked by whatever words someone is saying, and I think the computers cannot capture that. So that is in our power, within our power, and that is what we will have over the computers. I think the algorithms would be difficult to make in some specialties, and some would be easier, like say dermatology, maybe because they work on photographs and things like that. But in some specialties, it's an art, not science, and specialties. So that's
Thank you, Tabinda. I want to close this program, but before we do that, Irfan, there's a question for you on the screen. You have been dealing with lots of notes as family medicine physician. What's your take on that? How will summarization help you in your work as a family medicine physician?
Oh yeah, it's what we do as a part of training to our, because I'm a trainer as well to students and junior doctors and GPs, that you cannot have a structured consultation with the patient without knowing their background. Okay, so the background is always come from reading the electronic patient record. Okay, electronic patient record is very complicated. It varies from area to area. Some areas is very good. They have kept all the record up to date. In some areas, it's not that great. And you have to dig the information. There's always a chance you miss something. If there is anything which will give you the background of the patient. So this is the summary in one paragraph of this patient. That is, I think, save a lot of time, and it will give the important things which patient come to see the doctor. Oh, this patient has got this in the past. So they don't need to dig the information. So I think summarizing data itself is not only better for the GPs or clinicians, but also it's better for research purposes. What is it? Research, evidence-based medicine, collecting the data, analyzing it, that's all. The issue here is data coding and summarizing the data effectively, which will help in clinical setting, in research setting, in financial setting, and also in, I think, in implementing or predicting the future risk of patient outcome.
It's very kind of you, Irfan. I think everybody has been able to contribute very well, including Mr. Singh at the beginning, then Dr. Chohan, Tabinda, Saima, and Irfan at the end. I just want to remind you that this is being streamed live on LinkedIn, YouTube, Facebook, and Twitter, apart from a direct link. And we will have a recording available for Mr. Morgan if he ever wants to review that, the part he missed. Mr. Morgan, I will hand over to Dr. Saima Niaz to close the panel. And then after that, Zarmina will close the whole program. Saima, over to you.
Dr. Chughtai, and I would like to thank everyone, all panelists, especially our prestigious guest, Honorable Bill Morgan, for taking time out and joining after the work this webinar. Thanks so much. And this would not have been possible without our chairman, founder of Conservative Friends of the NHS, Dr. Ashraf Chohan. And this is our last webinar for this year, and we will be coming with more powerful webinars in the new year. So I'm going to hand over to Zarmina. Thank you, everyone, and thanks all the participants who have joined online. Thank you.
Thank you very much to our speakers, our audience, and conservative friends of NHS. As Dr. Suhail mentioned, the session is recorded for those who are unable to join and will be shared on various platforms. We hope you will join us for the subsequent episodes of this webinar. We will aim to continue to have an episode out every week on the same day, Thursday, 6:30 p.m. UK time, to continue to explore how AI can improve quality of healthcare in NHS. Thank you so much, everyone.
Thank you.
Bye-bye.
Bye. Thank you.
In NHS healthcare, the quest for better patient care is never-ending. Artificial intelligence has a transformative influence on healthcare. AI helps him analyze patient data faster and more accurately. This leads to precise diagnoses and personalized treatment plans. AI also helps in predicting potential health risks. This proactive approach improves patient outcomes significantly. AI is not replacing doctors, but empowering them. Together, they are revolutionizing healthcare. Empowering the NHS with AI hallmarks a revolution in medical care for a healthier future. Because with AI, better patient care is possible.
Gee, that's